What's going on, everybody? My name is Matty Willz, midday personality on Z1079, of course, and welcome to another one of our weekly press briefings that we've been having lately with the Cuyahoga County Board of Health. Now, of course, the pandemic has ravaged 2020, and we're just trying to get as much real information to as many people as we possibly can. And this week, we so happen to be talking about the vaccine, which is why we have the very esteemed Dr. Sherrie Williams. She's a critical care doctor for the Cuyahoga County Board of Health. She's also one of 5 board members for the Cuyahoga County Board of Health. And we spoke with her yesterday evening. We'll just continue that conversation on into today about the vaccine. Sherrie, how you doing this morning?
I'm great, Matty. Thanks for having me.
Thank you for joining us, and thank you for, spitting these facts, as we like to say, about the coronavirus, particularly the vaccine. We got a lot to get to, so we're going to jump right into it. Just real quick, though, for the viewers, please leave any questions that you may have. If it's about the vaccine, if it's about COVID in any facet, we would like to get the experts' answer to it. So feel free to leave in as many questions and comments as you possibly have. But Sherrie, let's jump right into it. We're talking vaccines, okay? The first question that we have set up today, how did the vaccine get approved so quickly?
Yeah, so, the vaccine is something that was actually pretty much paid for by the taxpayers. The government authorized an expedited process. So that's not to say that critical steps were, shortchanged or abandoned altogether. That's just not true. The same steps that vaccine makers use in terms of reviewing data, the phases of trials, all of that remained the same. What helped to speed things along is that the money was put up front from the taxpayers. The government authorized money to develop the vaccine and to start mass producing it so that when it would get approved, we wouldn't have a backlog or time lost. So a lot of the bureaucracy and the red tape and the funding issues were cut short or were not in the making of the vaccine.
So it's good to know that, no corners were cut. It's a global pandemic. So, we have to do extreme measures to make sure that, people are properly taken care of during this kind of crazy time that we're in. So let's just really kind of get into the meat and potatoes, as my grandmother used to say all the time. Why should I or my friends or my family members trust getting the vaccine?
Mm-hmm. Yeah, I think one of the things to keep in mind is that the same researchers and scientists that develop vaccines, medications, and other therapeutics that we all use every day and have used for, decades upon decades are the same people that are making this vaccine. And one of the things that we know is that this disease, COVID-19, is a killer. It has killed a lot of people, over 300,000. Wow. And unfortunately, disproportionately, our people, Black and brown people, have died at greater rates than others. And so when you stop and think about why should I, the real question is why shouldn't I, in terms of how many people have been lost. And this we know is true. And so this is our best hope and our best chance for keeping people from getting COVID-19 and reducing the morbidity and mortality from the disease. We have seen that there are some long-lasting effects from getting this. So even people who survive, we know have some challenges even after they have recovered and have made it through the critical illness part. And so there's a lot that we still don't know in terms of long-lasting effects. And so if we can keep people from getting it, keep people from getting severe disease and dying from it, then here's an opportunity to sort of change course and direction, especially for our people.
Great answer. And it makes me feel a little more comfortable just with you saying that. We want to check in with Sierra Connors, who's sending us a wave this morning. We appreciate you checking in with us, and Monet Luster for checking in and saying good morning as well. If anybody watching has any questions for our guest today, Dr. Sherrie Williams, about COVID or the vaccines or anything, along those lines, please feel free to drop those right there in the comments and we'll get to them. All right, Sherrie, up next we got, what if I can get the vaccine now, but I'd rather wait and see how it reacts with others before I get it? Is that a good decision?
Yeah, so people always think about things, and I would encourage people to, think about it, do some soul searching. Be honest, be real with yourself. I had to be honest and real with myself. I was nervous. I was afraid. I would be lying if I got on here and said that, I didn't have a moment of pause. I did have a moment of pause. And what I'm saying to others is, in your moment of pause, where you're thinking about this and you may have some, nervousness or fear about it, there are a couple things that I would leave with you that I found myself saying. So one of the things I found myself saying is, okay, so yeah, there are some things that no one could ever know. What's going to happen to people who got vaccinated for this 10 years from now? None of us have a crystal ball to see what's going to happen to all the people who got vaccinated 10 years from now.
Right.
We don't know that. So there's nothing that's 100% in life. What you can do is just go by what you know to be true today. And what I know to be true today is that people are dying. And when I gave pause myself, I started thinking about all the people that I had seen that had died, all of their loved ones who sat and cried. I saw people sit and cry till there was a puddle on the floor with the tears, crying about their loved one as they sat out in the waiting room because they can't be with their loved one in the room. So I thought about all of those people. And when I thought about all those people in my moment of pause, I said, how could I not do my part to, have some personal responsibility to help the community to achieve a certain amount of immunity? And we know that if we can get as high as 70% of the population vaccinated, this may provide an overall societal immunity that can help turn the tide here. I think the other thing that I thought about, and this is something historically that has meant a lot to us as Black people, is there have been times when history has shown that treatments and therapeutics were not offered to us because of a whole host of reasons, but largely racist reasons, right? So in the Tuskegee, and history is out there for people to read, in the whole Tuskegee event, even after penicillin was made available for people who had syphilis, it wasn't offered to poor Southern Blacks who were in the quote unquote study. That was wrong. That was wrong. And now we have an opportunity, and we know that this disease is disproportionately killing Black and brown people across the country. And we have an opportunity for something that would help. Should we not consider taking it?
Right.
I actually would be, and I thought this for myself, I'd actually be pissed off if there was a vaccine and everybody else is getting it and it's not offered and I don't get an opportunity to get it. And it's, my own people that are dying left and right. So I found myself saying, even though I was afraid, even though there was this history, when I added up all the pros and cons, I found myself still being heavily weighted on but this is a chance for a better outcome for us.
Yeah, Yeah, you really put things into perspective when you just talk about what wasn't offered to us that would have helped us, and now what's being offered to the entire country. So we do have a question that comes from a couple of viewers, and it's one of our planned questions. So I'll just roll with it. Is it safe for kids? Black Bonnie Davis put that up first, and Sierra Connors wants to know, yeah, is the vaccine safe for kids? So we were planning on talking about both children and pregnant women. Is the vaccine safe for either of those?
Yeah, so the first vaccine that came out, which is the Pfizer, did have teenagers in it, as young as 16. And so the Pfizer vaccine is authorized for emergency use. So when we say emergency use, we just mean that there isn't a formal license yet, but because we were in an emergency situation, it's like, the house is on fire. I'm not going to stop and pack a suitcase, right? So here the country is in dire need, and so an emergency use was authorized for the vaccine based on who was in the trial. So the trial had about 40,000 people, a little more than 40,000, and there were kids in it, age 16 and up. So the Pfizer vaccine is authorized for age 16 and up, the Moderna for age 18 and up. So young children that are 10 and 12 weren't studied, and at this time, there is not a vaccine for them. Now, having said that, there are ongoing studies and trials that are looking at children. It is my anticipation that at some point we will get there in terms of having enough data and children in studies to be able to say that we can safely vaccinate them. But right now, what's available now is age 16 and up in terms of vaccination. Pregnant women, the recommendation from the society that deals with pregnant women, the Association of Obstetrics and Gynecology, they have recommended that if you are pregnant or breastfeeding, it is a personal decision. You can discuss it with your doctor, but there's no evidence to say that you should not be vaccinated. In fact, they're recommending for high risk women. So if you're someone that has diabetes, let's say, or renal insufficiency, or you work in a healthcare setting, or you're somebody who is a frontline worker where you're dealing with a lot of clients and personnel, you really want to think about getting it, even if you're pregnant or breastfeeding, because you're at risk. And there's no evidence to say that you shouldn't. There were actually pregnant women in the original vaccine trials. And so I would encourage women who are pregnant or breastfeeding to talk it over with their obstetrician. But I can tell you that the recommendation is that they should be vaccinated. And if you're a high risk person, I wouldn't hesitate, because we know the outcomes of COVID-19 in people who have risk factors like diabetes, kidney disease.
Exactly. So, again, if you're just joining us, we're speaking with Dr. Sherrie Williams of the Cuyahoga County Board of Health. Dr. Williams, if most people don't get the vaccine, what will the impact of that be?
Yeah, so I think if most people don't get it, we'll still be struggling with a lot of people dying. We will still be struggling on how to balance our kids going to school, how to balance our businesses being open, how to balance having a relatively normal life where we can get together with friends and family. So being vaccinated and decreasing the rate of spread in the community gives us a certain freedom to be able to have some semblance of a normal life. Now, we're going to still have to wear masks. So people have asked me, so once I get vaccinated, does that mean that I don't have to wear a mask? No, you're going to have to wear a mask. And the reason is I got vaccinated, but there's still plenty of people who are yet to be vaccinated. And so it's going to be some time. And the other thing that we just don't know yet is how long is the vaccine protective. So 3 months from now, 6 months from now, we do believe it will still have some protective effect. But exactly how long, we're still working to sort that out. Will we need to get vaccinated every year? That's possible. So there's still some things that are being studied. Ongoing research and ongoing studying of the vaccine and its effects in the community is still taking place. And while that's still taking place, and there are a lot of unanswered questions, you still have to wash your hands, watch your distance, and wear a mask. I'm going to be wearing one, and I was, one of the first to get vaccinated, but I'm still wearing a mask.
That's right. Now, I'm going to go off script for just a minute. This is something I mentioned on my show. And this is more in jest, but if you're riding in a car by yourself with the windows up, do you need to have the mask on? I see that a lot on my commute down to the radio station, and I just think that it might be a little overkill. I don't know. Maybe that's just me. I mean, better safe than sorry, right?
So, better safe than sorry. But, quite honestly, if you're in the car by yourself and you don't have your mask on, you're not around anybody,
right?
It's probably fine. I ride in my car sometimes without my mask on in my car, and I'm by myself. Here's the thing that has also happened to me, though, and one of the reasons why I have started to wear it more often in the car is I don't have it on. I jump out the car, start walking across the parking lot.
Gotta take that walk of shame back. Yeah.
I gotta walk back to the car. I forgot my mask.
Yeah.
So here's the thing. I've gotten into sort of putting it on just like I would put my glasses on. It's like I feel naked without my mask. And so I find that if you just go ahead and put it on, then you don't have to walk back across the parking lot
and worry about it, right? Now, I was teasing. It's just funny when I'm driving to work sometimes. All right, so let's get back to the list. Now, this is a big one. What are the side effects from getting the vaccine?
Yeah, so I have to say most of the side effects are side effects people have with any vaccine. My shoulder is sore because you get it in your upper shoulder, your arm. And it's like I can hardly lift my arm. It's so sore and stiff and a little painful at the injection site itself. Many people will have headaches, muscle aches. Some people may have a low-grade fever. And a lot of times people are like, oh, I know they must have given me the COVID because I got that shot and I got sick right after. And people will tell me that. I'm a lung specialist. I give lots of vaccines. People will tell me that. And one of the things I say to people is, here's the thing. Your immune system, and this is what the vaccine is designed to do. By design, it's designed to turn on your immune system and ramp up your body's natural defenses to fight the virus. And so your body, as it's doing that, may have some muscle aches, may have some chills, headache, low-grade fever. This is a general reaction and is expected, and actually in the trials, that's what most people complained of. Headache, chills, low-grade fever, aches. Even people would say, yeah, I normally have, like myself, arthritis in my knees or something, and I noticed that it was a little more painful than usual. So general reactions that many people have to vaccines that they get all the time, like flu or hepatitis, the common ones people get as kids. Actually, a lot of us got shots as kids before you could go to school, remember?
Right. Now, you did touch on something yesterday. I wanted you to bring it up again today. Just speaking of the side effects from the vaccine. A lot of people, a lot of our people will tell you that they're injecting you with the coronavirus. Is that true?
Not true. There's no vaccine that at this particular point in time, what's out on the market, the Pfizer, the Moderna, this is not killed virus or parts of virus. It's not virus. It is a genetic code to a spike that is on the virus. And that genetic code is like a telegraph or a message to our own immune system to make antibody or anti-spike kind of protein. So it does not have any capability whatsoever to give you COVID or to give you coronavirus. It's simply a primer of your own immune system. And this is one of the reasons why you need 2 doses, because the first dose sort of primes the pump, and the second dose sort of reinforces or boosts the immune response. And so sometimes people say, well, if I get 1, is that enough? No, 1 is not enough. We know that it takes 2 doses to be 95% effective. And so I would tell people, don't get 1 and then say that's enough. Get both doses so that you're fully protected. That's where the 95% comes in.
Got you. Now, you did just mention the 2 different vaccines that are available currently. Can you just elaborate on that? And you also mentioned before that you anticipated possibly one that's in trials now to be available for children at some point in time. But the 2 that are available right now, can you just speak on those and what the differences are?
Yeah, so the first that came out was Pfizer. And Pfizer is a pharmaceutical company, been around a long time. It partnered with another company, BioNTech, that made the first one that was approved. And people probably saw it on the news that it required an ultra freezer. So it had to be stored super, super cold. And, there are not a lot of places that have that ultra cold freezer. And so the second one that's out, Moderna does not require that ultra cold freezer. And this is the one that is actually being shipped out now and is probably a little more practical for some areas where the ultra cold freezer is not readily available.
Right.
So in the future, there's research out there for a one-time vaccination. There are people working on that where you can get a one and done, but they're not there yet. And they have to go through the same process the first 2 went through in terms of people reviewing their data and looking at what happened in all phases of the trial to make sure that it not only works, but that it's safe, right? So it's not enough that it works.
Right.
It has to be safe as well as it works.
Well, we're glad they're crossing their T's and dotting their I's with all that good stuff.
Absolutely.
We do have a question from a viewer, Nichelle Shaw. She says, hi, Dr. Sherrie. What if one household member gets the vaccine and the others don't? What kind of impact does that have on the household? Thanks for the question.
Hi, Nichelle. It's good to hear from you. So, if one person in the household gets it, it protects that person. So if other members in the household come into the household around that individual who's been vaccinated is less likely to get severe COVID-19 disease or infection. The thing that we're not as certain of is when someone, and this is another reason why we're encouraging people to wear masks, when someone gets vaccinated, although they're protected from getting severe disease, that doesn't necessarily mean that they can't be carriers to other people. So the person who's in the household that is vaccinated shouldn't be of the mindset, I'm vaccinated, and so I won't give disease to the other people who live in the house with me that are not vaccinated. We don't know that to be true. It is possible that that person could still carry the virus and give it to non-vaccinated people in the household.
That's
And
an important detail.
because those people haven't been vaccinated, that could be a problem for them. So the ideal situation is everybody get vaccinated.
Yeah, yeah,
So
that's an important detail right there because I wasn't sure about that, and we that wasn't one of the questions. I'm glad you pointed that out. So just to clarify, if you do get vaccinated, both, you're 95%. That 95% means that you're 95% not likely to develop severe reaction to COVID, but that does not necessarily mean that you cannot then pass on COVID to other people. That was a good note right there. I'm glad you
right,
said that.
we're still studying that. We're still studying that, but there is no 100% that just because I've been vaccinated doesn't mean that I couldn't carry it and transmit to somebody else. We're studying how effective the vaccine is at
Right.
doing that. But when the study was done, the primary endpoint, what they were looking at as the goal, was prevention of severe disease, because this is what kills people.
Right.
People get in the hospital, they have severe disease, they're on respirators, and we can't, get their lungs functioning and they die. So what the vaccine does is prevent severe disease. The issue of how much transmission is still being studied. And this is why, like I said, another reason why we're saying we want people to wear masks,
Right.
and as many people as possible that can get it. If it turns out that, yes, we have a lot of data now that says once you've been vaccinated, you're less likely, maybe not 100%,
Right.
but less likely to transmit it. That's another reason why the more people who get it will be in a better place.
Absolutely. Absolutely. Now, we keep talking about the trials that are ongoing and that were taking place before the two that we have that finally got approved had to go through their own trials. How many black and brown people were actually included in this trial? Because I think that, if my brother doesn't believe that they tested it on any other brothers, then my brother is less likely to get it.
Mm-hmm. Right. So actually, and I'm going to send to you, Matty, when we get off this call right here, I'm going to send to you the table that came from the trial. And it has laid out on the table all the demographics of the people who participated in the trial.
Sweet.
Ages, race, sex. And so the reason why I think it's important for people to see that is of the 40,000 plus people who were in the study, as much as 10% were African American or Black people. Our people were about 10%. Amongst Latinos, we saw about 20+%. So in the study, there were Black and brown people, and the study confirmed, and actually there's an article that just came out in the New England Journal of Medicine. So the New England Journal of Medicine is actually a journal that many doctors, it's a reputable journal amongst all doctors, doesn't matter your specialty, people read, and independent doctors and researchers all across the country looked at the data and came to the conclusion that the same people who looked at the original trial and approved it at the FDA level came to that the vaccine was safe and effective across ethnic differences, across age differences, and even in people who had certain chronic disease categories. And there weren't any more adverse outcomes or bad events in each demographic. So I think it's important to see the actual table because it gives actual numbers of thousands of people.
Sweet. And yes, we will be getting that up, that table up on our website, zhiphopcleveland.com. So you guys can check that out today so you can see that data. So now here's another big one, right? Because sometimes we don't know how much stuff costs. What type of insurance will people need to get the vaccine?
Yeah, so one of the beauties of this is, as I mentioned before, this vaccine was paid for by the taxpayers. The government authorized it, paid for it. And, people will say, oh, yeah, the government paid for it. Yeah, but the government gets its money from the taxpayers. That's you and me. So we paid for it. We
Right.
paid for it. And because it's been paid for, when the drug is shipped, the supplies that are needed to go along with it is also shipped. And so the only fee, so to speak, and the charge for that fee might vary from place to place, is really the manpower, the labor. So somebody has to be paid to be
Right.
in the shop. The nurse, the pharmacist, somebody has to be paid. So people are allowed to charge an administration fee. That's the fee for the manpower to give the shot, the document in records that have to go to the state about numbers so that we can keep track of how many people have been vaccinated. So that part is something that institutions can charge an administrative fee. There may be some institutions that feel like we'll eat that cost. There may be some that charge insurance for it, but the administration fee is a relatively small fee. Usually the biggest expense of a vaccine is the vaccine itself.
Gotcha.
So the administration fee is likely to be a relatively small fee, likely to be covered by insurance, and likely in the community, there will be places that will not even charge an administrative fee. But
Got you.
it's something that I think will vary from place to place, but I'm certain in the community there'll be places you just go and get it because it's just that important.
Yeah, super important, obviously. Global pandemic. So, again, if you're just joining us, we are with Dr. Sherrie Williams of the Cuyahoga County Board of Health talking about COVID, talking specifically about the vaccine. We do have another question from one of our viewers who asked, are there any long-term effects of the vaccine? Comes from Mr. Ohydro. Shout out to him.
All right. So the long-term effects are still being looked at. Remember that people in the vaccine trial have been in the vaccine trial now for several months, and we have not seen long-term effects in that initial group of people who are in the study. Because this is new, none of us know. None of us can have a crystal ball to see what are the long-term effects 5 years from now from this vaccine. There's no way to know that. What we do know, though, is that there are long-term effects from the COVID infection. And we're seeing that now in people who had COVID, survived it back in March or April, and here we are in December, and those patients are still struggling with fatigue, trouble with their memory and concentrating, trouble with depression and sort of a PTSD kind of syndrome. There are people that are still having what we would call sequela or ongoing symptoms from this infection. And a lot of people with depression, following the COVID, in terms of realizing I've been through a horrific thing. I barely survived, and I actually came face to face with death. And that has some people a mental health effect, and that's just as real as any joint aches or memory problems to be, struggling with that. So there are a lot of long-term effects that we've seen from this virus that I think we'll even learn more about going forward. As far as the vaccine is concerned, we may find that 5 years from now, there's nothing long-term. 5 years from now, we may find that there are, but by and large, the vaccine creation uses a lot of the same scientific principles that are used in so many other things that I think we are on solid footing to say that there's no evidence at this point in time that there should be significant long-term effects. Don't have a crystal ball.
Right.
Anything could come up down the line because that's the world we live in. There are
Right.
no 100%.
So if a person has already had COVID, we heard in the news antibodies a lot. Should they get the vaccine if they've already been through COVID and they have those antibodies? And then also kind of like on a part two to that question, if you currently have COVID, should you get the vaccine?
So the recommendation is if you have had COVID, you should still get vaccinated. And one of the reasons is the antibodies that people form after having COVID, we're not exactly sure how protective they are. And in fact, there's some data that says that it may not be as protective as we would hope or want it to be. There are case reports of people who have had coronavirus, survived it, and then gotten another infection. And we see that the antibodies that people develop naturally after getting infection sort of wear off over time. So we're not certain that having it once makes you super, super protected. No one is saying that that's a guaranteed fact. What we know is that getting vaccinated will have a 95% effectiveness in protecting you from severe disease. And we know that those antibodies last at least 2 months, and many people are saying 6 months, and we're still studying to see if it could be the type of thing like a flu shot where you need a dose every year. That is still being worked on, but for sure, 95% for several months is a guarantee. COVID, natural infection, people aren't sure. As far as getting vaccinated, if you have active COVID infection, so let's say, I'm living with my partner and my partner ends up getting coronavirus, and now I have symptoms of a fever. I can't smell, I can't taste. I think I have COVID, or I got tested, and sure enough, we both have it because we live in the same household. The recommendation is to wait to get vaccinated until you're over the acute illness. So we think you should still get vaccinated, but we don't want to vaccinate you while you're already trying to fight an acute infection. So waiting until the acute infection has resolved, you're not running a fever, and you're past it is the recommendation if you are actively with coronavirus positive infection.
Got you. We got one more question from our viewer. Comes from Nichelle Shaw again. I have another question. Since we have to get 2 vaccine injections, and there are at least 2 approved vaccines out there now, how will I know for sure that I'll get the same vaccine the second time? Which is a good question.
That is a good question. Thank you, Nichelle. And this speaks to something that I mentioned earlier in terms of the places that are administering the vaccine have manpower needs. And part of the manpower needs is the documentation. So you can't switch from Pfizer to Moderna. If you start off with the Pfizer vaccine, your second dose has to be the Pfizer vaccine. So that means that someone the pharmacist, the nurse, the hospital, the clinic, wherever it happens to be, is maintaining records of what you got the first time and then making sure that they follow up with you in 21 days to get the second vaccine.
Gotcha.
Additionally, there are cards that people will get. When I got my vaccination, I got a card, and on my card, it says what I got. So I would encourage people to get your card, put your card in a safe place so that you'll know what you got. But the people who are administering the vaccine are also keeping track of what you got, and the date is put on there so that you know that you're scheduled for your second dose 3 weeks from when you got the first dose. So I even was talking to my daughter today, and I told her, I said, I got my vaccine a week ago tomorrow. So I'm getting my second dose 2 weeks from tomorrow. I got it down on my phone, on my calendar already, so that I can be there to get my second dose. Don't want to miss it.
Don't want to miss it, indeed.
Don't want to
Now,
miss it.
we got one final question. Again, if you're just joining us, we encourage you to watch. The live will end soon in the next couple of minutes, but the video will still live on our social media channels and our website. So I encourage you to go through it. If you have any questions about the vaccine, the coronavirus at all, we've been speaking with Dr. Sherrie Williams of the Cuyahoga County Board of Health. She's been wonderful, great answers. So please, if you just got in here, if you got in late, go check it out. But final question for you, Dr. Williams. Why can't everybody get the vaccine right now? Why can some people get it now when others can't? And when will most people be able to get it? And I know that's technically 3 questions, but it's all the same thing.
Yeah, you got me with 3 good ones. So Matty, when people make vaccine, and this is really a testimony to how carefully vaccines are made. So just because you have a recipe and you know how to make something, when it's made, you have to do quality control and checks. So you have to make sure that particular batch that you've made is 100% like the batches made before. And so each time it's made, they have to do quality checks. They have to pass the quality check. It has to be packaged and shipped out. And so there's a limit to how much can be done at any one time and then shipped out. And then at the institutions that are giving it, they have to have their plan of operations for actually vaccinating people. So all of this takes time. And it's not an easy vaccine from the standpoint of a one and done. You got to make sure that you're keeping track of which one you got. You got to make sure you have a way to follow up with people. You got to make sure that you know when the timing is. So you got to have a new shipment in to make sure you have enough to do the people you did 3 weeks prior. There are a lot of what I call nuances to it, and that requires time. So when we look at it takes time, who are the people that don't have time to spare? Okay,
Sick people.
so this takes time. Who are the people that don't have time to spare? So when you look at who doesn't have time to spare, your healthcare workers,
Right.
the nurses, the doctors, the respiratory therapists, the people who are taking care of sick people in the hospital. We don't have time for them to get sick, because if they get sick, then who's going to take care of everybody else?
Right.
So they don't have time to spare. Nursing home residents. So when we look at who ended up dying from this, do you know that nursing home residents are only about 1% of the population, and yet they were about 40% of the people who died? And these are the people who are most vulnerable. They can't help themselves. If they could help themselves, chances are they wouldn't be in the nursing home.
Right.
And so somebody's grandma, grandpa, auntie, sister, brother, cousin is in a nursing home somewhere, and they don't have time. They can't wait. And the people who are in the nursing home, who are taking care of them, they can't afford to be sick because the nursing home residents are counting on them to be well and to not bring the disease into the nursing home. So this is why we started out with healthcare workers, nursing home residents, and the employees in those nursing home facilities. And then we start working towards our senior citizens, young, healthy people in their 20s and 30s are likely, if they were to come in contact with it, fare better. But we know they're spreaders of this. And this is another reason why we're going to eventually get to the younger population. So we're asking people to be patient. And when it's your turn, to still get on out there because it's the best thing for all of the community if we can keep people safe.
Sharp answers once again, Dr. Sherrie Williams. We greatly appreciate all of your expertise in this. Again, we just concluded another one of our weekly press briefings with the Cuyahoga County Board of Health. We appreciate all the commenters, all the viewers. Hopefully, I think we got everybody's question in. So if you guys have any other questions, if you came in late, I'm sure it was answered at some point. Again, as soon as this live ends, you can go watch the whole thing from start to finish. But thank you. And hey, I hope you have a great holiday, and we'll be speaking with you guys next week. I do like to get, and they just put it down there at the bottom, thank you, because I was about to forget, to reach you guys. Your website is ccbh.net, and then your phone number is 216-201-2000, and then we'll also have information on our website, zhiphopcleveland.com as well. But thank you. You're a smart cookie. We appreciate you.
Thank you, and happy holidays and blessings in the new year.
Same to you. Same to you. We'll speak with you guys next week. And thanks for watching, guys. And I hope everybody watching has a great holiday and a great rest of your day.